about the longest capitis, which is here, and he's going to have to try to lift his head, just his capital, against gravity, right? So gravity's pushing his head down here. So I'm going to ask him, Taylor, tilt your head all the way down. If he can do that all the way, full range, full active range of motion, yes, he's at least a 3. Now what I'm going to do is take that a step further. He's going to be in that position. I'm going to take my hand underneath his jawline and just try to gently pull him back. If he can take full maximum resistance, that is a 5. 4 is moderate, and 3 is he can't do it at all. Okay. A 2, if while looking at him he gets kind of there, but then I come in passively and he can go further, then that's a 2. Now don't confuse, like go ahead Taylor, do your best, and I can kind of get him just a smidge more. Again, that's just passive anatomical barrier being further than the physiological barrier. However, if he only went that far and I can take him significantly further, then you have to make that assessment, okay, between a 2 or a 0, okay. All right, I'm pretty sure cervical flexion. So that's capital flexion. So then we go down to cervical flexion. Yes.
That's a question.
Mm-hmm.
So how is testing for 3, 4, and 5 in supine gravity dependent, and then when you test it for
It's anti-gravity. And then for 0, 1, or 2, so what they're saying for the cervical flexors, again, remember that's the general principles, and then there are ones that are different. This is one of those that are different than the general principles in that if I wanted to put this person in a gravity eliminated position, we would put them in side lying, and so now I have to support the head and see if they can tilt again, and that's just a lot to juggle. And so as far as the standardized assessment goes for this one, full range is a 3. 4 or 5 depends on how much resistance they can take. Maximum resistance 5, moderate 4. If they can't take any without breaking, it's a 3. But a 2 now is if they get through partial range, because it's anti-gravity. They can get through partial range. They're saying that's a 2. Okay, where for some of our other tests we would change the position entirely for a lot of our other muscles. Okay.
Is capital AL or OL?
Capital AL. That's a good question. Okay, 5, 4, 3, 2. 10 head of table.
Yeah, capital.
capital, like capital of the state, capital of the country? Yeah.
Capital letter is AL. Capital letter, like capital.
Okay.
What's capital letter?
A.
That's odd.
I'm gonna murder you.
Because you're not capital murder.
Okay.
Murder.
So this is going to be one. This is again one. This is going to be one of those awkward ones. If you go to page 28. So now we're going to cervical flexion. So now what I'm going to be asking him to do is to lift his head off of the table, but without tucking his chin. So just the head, okay? So just your head up like that, but not the capital, right? So go ahead and lift that up. If he's able to get through full range of motion, I will give him resistance. Okay. Here's between 4 and 5 there. So he's 4 like 4 or 5. Okay. 3 would be the ability to go through the full range of motion and not take any resistance. So that's 5, 4, 3. Okay. Now it gets funny for 2, 0, and 1. For the 2, the person's still going to be standing with the head supported on the table, their arms at their side. I'm standing at the head of the table with both hands over the sternocleidomastoid, and the patient rolls their head side to side, keeping the head supported on the table. That's interesting, right? We're testing flexion, but we're being told to do rotation. My hand's on the sternocleidomastoid. Can you rotate your head to the right for me as best you can? If he gets through full range of motion, it's a 2. That way, okay. A 1, I am palpating the sternocleidomastoids to see if they contract, okay? All right. So that's how you do 2, 0, 1 for cervical flexion.
Makes sense.
It makes perfect sense, right? Just like before with the head and neck, you can do combined. So combined is the full lift in 3, 4, 5, okay? And then combined for the lower numbers, I think again is attempts to roll the head side to side. Okay. This one I do want to do. This is for isolation of a single sternocleidomastoid muscle. So with the combined and with the cervical flexion, you're really looking at that sternocleidomastoid to create that force moment. Okay, you can put your head down. Okay, but what if I want to look at one versus the other? What you can do is you're going to have the person rotate their head to the side fully first. Now what I want you to do is lift your head up sideways off the table all the way. Now this sternocleidomastoid, his left one, is doing all the lifting for him. And then I can go ahead and try to, look at that, okay? So that's the isolated sternocleidomastoid test. You have to do to both sides, okay? So that's 5, 4, 3, 2. The patient completes partial range. I'm sorry. Yeah, completes partial range, and one is a palpation, the contractile palpation. Okay?
Like they can rotate and then
Huh?
partial.
That one's like the
That's the, if you want to,
I think it'd be like
somewhat to get their hands lifted.
okay?